This time of year, holiday parties are happening almost every weekend, and for those with young kids under a year, it really can be hard for them to keep those kids healthy. You know what I'm talking about. So joining us right now is Dr. Christy O'Day, a family and community health physician at UC Health, kind of breaking down what we're seeing. And obviously the intro talked about young kids, and that's something we all worry about as parents out there. But it's also the adults, and you know, if you've watched over the past couple of weeks, I fought the nastiest flu I have ever had in my entire life. And sadly, we see that going around. I'm healthy now, everything's good, but you're seeing a lot of just uptick in cold and flu season.
Yeah, absolutely. This time of year when we're all together, like during Thanksgiving, we're together with our family and friends. We are passing our germs around.
Yeah.
And so we definitely see more respiratory viruses going around this time of year. And we'll continue to see that, I think, through the holidays.
So for people that don't know, you guys know, obviously, we've talked a lot about COVID and about the flu, but RSV is something you see in younger kids. What is that?
Yeah, so RSV is a really common virus that actually affects all of us, adults and children.
Okay.
And most people, it causes mild symptoms like runny nose, cough, body aches, maybe a headache. But in some people, it causes more severe illness. So we see that more commonly in really young kids, so babies less than a year. It's actually the most common cause of hospitalizations in babies under a year. And then also in older adults. So in adults over age 75, it's a very common cause of hospitalization. And unfortunately, we see about 6,000 deaths or more per year in older adults, and then between 100 and 300 babies each year die from RSV.
It's such a scary thing, especially if you do have young kids. Talk about that. It's viral, so you can't really treat RSV per se. You can treat the symptoms around it and things of that nature, but that's why it's so important to wash your hands. And if you are sick, don't go to those parties, right?
Yeah, absolutely. And if you have babies at home and people are coming to visit, I encourage you to, if people are sick, don't have them hold your baby, or if they need to, make sure they wear a mask, obviously, and they should always wash their hands before they hold your baby. But there's lots of new things that we can do to prevent RSV in infants. And so recently the FDA approved a immunization for pregnant women.
Okay, great.
So for women who are going to deliver during RSV season, so between October and March, we recommend that they get immunized. So if you're between 32 and 36 weeks pregnant, we recommend that you go ahead and get that immunization now and talk to your prenatal provider about getting immunized.
Well, it is such a dicey season with all of what we've talked about, so you really do have to try to prepare yourself as best you can. Doc, thank you so much, and if anybody has any questions, you guys obviously have a lot of information at UC Health.
Yes, we do. Please contact your primary care provider if you have any questions.
Doc, thank you so much. Happy holidays to you. All of that information is, as always, on our website at fox19.com, so you can check it out and be safe and hopefully healthy this holiday season. Doc, thanks.